Have y'all seen this? All men, please come up to the front of the class. Thank you. Welcome to She Knows DNA. My name is Miavonna and I am a board certified genetic counselor. So since Sunday was Father's Day, I figured it would only be befitting to cover a genetic condition that only affects men. With that being said, let's get into it. This topic does fall under DSD, so those are differences of sexual development. Have you seen in some of the last videos, you'll know that there were about 3 categories. So today's syndrome is in category number 1. So we know in category 1, that means that there is some type of abnormality in the number of sex chromosomes. Remember, the sex chromosomes are the X's and the Y's. So females have 2 X's, males have an X and a Y. However, there is a condition out there that we refer to as 47XYY, otherwise known as Jacob syndrome. Now, as you see, this is something that we're not expecting whenever we are looking at a person's chromosomes, because here, this person has way too many Y chromosomes. They just need 1. How this happens is there is essentially an interruption of the sperm's DNA during the splitting apart process. So it's very random. It's just that some of the Y's did not separate like we would expect them to, resulting in a person having too many Y chromosomes. Jacob syndrome is said to affect 1 in every 1,000 people, men, meaning that a lot of y'all are out there with Jacob syndrome and you don't even know it. That honestly does make sense as to why people may not know that they have Jacob syndrome, is because as far as the symptoms, they vary. There is a good amount of men that do not have any symptoms that would make us automatically think, oh my gosh, you have Jacob syndrome, come on. But then there's that other side range where there are many signs. So let's go over what those are. So you would think that those with Jacob syndrome, they're really big and swole, right? Because they got that extra Y, walking around here like a defensive lineman, right? Joke's on you. They do not look how you would expect. Some of the physical features that relate to Jacob syndrome does include having increased belly fat, macrocephaly, meaning they have a large head. They may have large teeth, be flat-footed. Their pinky finger may have a little curve in it and it curves inward. Hypertelorism, meaning that the eyes are spread wide apart. And then they may also have scoliosis. With Jacob syndrome, there could also be some developmental or learning type of difficulties. So those do include having problems or delays with speech and language. They may have some delayed motor skills. So maybe they're not sitting up and walking based off of the normal timeline that we should expect a kid to. They also may have weak muscle tone, which that does not help when it comes to those motor skills being able to work as they should. Then a person with this condition, they are at a higher risk of seizures and asthma. Also, there can be components of anxiety, depression, ADHD, and autism. Another feature to mention is that sometimes those with Jacob syndrome are infertile. But that's not everyone, but it is a percentage. Hey, Deuce, what did you say? Oh, that's a good question. Thank you, Deuce. For those that weren't able to hear, he asked a great question of, does this syndrome affect a person's testosterone levels? Great question, Deuce. A lot of times, no. There's been some research going back and forth as far as, is that truly going to increase the risk of course, not only having that higher testosterone, but if that leads to aggression. But there's not anything consistent, even though we do know that behavior problems are definitely a part of Jacob syndrome. Whenever you look at the testosterone levels, though, I would expect that everyone's levels, all the guys' levels, are pretty normal. As far as the thought of, can this condition be passed down through generations? The answer is no. This is not an inherited syndrome, so it's nothing that was passed down from mom or dad onto the baby. It is very random. There is no cure for this condition, so really what you're going to be doing is just trying to manage the features that someone does have that presents with Jacob's syndrome. So for instance, there may be some facial treatment because this does come with severe cystic acne. There may be some things set in place at school for the learning difficulties or even the behavioral difficulties. So I know there's also like speech delays. So they may do speech and PT and OT, all of those services while they're at school or just in general. That way it can help with whatever type of delay or social issue that they may be dealing with. I hope you all were able to learn something today. And now to leave you with words of wisdom. So today's words come from my Uncle Bud. My Uncle Bud is the brother of my grandfather, my papa. May he rest in heaven. So y'all listen, on birthdays, Uncle Bud is known for calling you at the crack of dawn. When I say that, I mean, 3:30, 4 o'clock, 4:30, when you really getting that good sleep in. And this past birthday, I accidentally left my phone on Do Not Disturb. So whenever I talked to him, you know what he said? He said, "This is crazy, niece, because I was just trying to ask if you wanted to go fishing. That's it. We could go fishing, and I know it's like 8 o'clock right now. We would have been back home by now, but no, you didn't want to talk to me, and now my feelings are hurt." So I'm gonna let that sit in y'all spirit, because how do you respond to that? How do you respond to it? And if y'all know my Uncle Bud, he is a jokester. Yeah, none of that makes sense. However, I do know if I don't get woke up at an ungodly hour by Uncle Bud, I'm going to feel some type of way. Okay? What you mean you're not calling me? You've been doing this for many, many years to all of us. I love my Uncle Bud. Well, y'all, that's all I have for you this week. Please continue to support me, and thank you all who have been. So please remember to like, subscribe, comment, share, do all the things. And of course, I am always willing to hear some suggestions, or if you all come across a topic that you know is genetics wise and you want me to break it down, just send it to me, all right? But otherwise, God bless you and God keep you. I can't wait to see you next week. So y'all have a blessed day and rest of your week, okay? Bye.